Hello, ladies and gentlemen. This is the podcast from World Changers, and today we have a really special guest. His name is Ilya. Go ahead and introduce yourself.
Hello. Yeah, my name is Ilya Petnitsky. I'm MD, radiologist by previous training and practice, and currently leading co-director at Neurotech One Lab at the University of Texas at Austin.
Awesome. And I did some research. I know that recently you published a research in Nature. Could you elaborate more on that? Use some simple language to explain what that research is.
Nature Communications on you probably mean, right? Because we also had recently in the General Nature publication as well, but another topic. But so yeah, for that publication that you are probably talking about, it's about our new device called NewSleep. So NewSleep is a wearable focus ultrasound EEG system. Actually, not only EEGs, it's a patch that we developed that includes our novel wearable focus ultrasound transducer for deep brain stimulation for various purpose, right? And then various electrodes. And so those electrodes we're using for EEG, also EMG musculography, and also EOG oculography. And so the idea is that we built this page as part of the DARPA funded program. So what they were seeking for is to develop, build, and test new technologies to improve specifically REM sleep, because it's quite tricky and challenging, and like no any effective treatment yet. And with specific focus of interest on novel neuromodulation technologies. And definitely non-invasive neuromodulation technologies are desirable because invasive are definitely effective, like deep brain stimulation, really effective for many patients, many purposes. But there are a lot of limitations, as you can imagine. So it's an invasive procedure, very costly, often costs over 100K, and so on and so on, many limitations. So we were about one of the team they selected, and we built this novel patch, basically combining three our innovations. So the hydrogel patch as a platform, then our novel wearable focus ultrasound, which also was previously published in Nature Communications as well a year ago, our previous paper, and then also our novel hydrogel based electrodes, which are also were published in quite a lot of publications already. And we have various generations of these electrodes. And so the idea is that these electrodes allow high quality long-term recording. We demonstrate high quality recording for over a month period. So they basically were suitable for applications. And so what we did, we built this patch, and then we demonstrated in 26 volunteers that we could first effectively modulate deep brain region called subthalamic nucleus to specifically improve REM and also sleep-associated stress symptoms, kind of improve stress adaptation. So this was also by interest of that DARPA program. And then second, we performed overnight stimulation, robotic stimulation. After that, we demonstrated that we validated that we could effectively improve REM sleep for around 25% just after one night of stimulation. And overall summarizing, first, this is actually, as far as we know, the first published work on wearable deep brain focused ultrasound neuromodulation. And then second, yeah, it's definitely quite large innovation for specifically REM sleep improvement, so for sleep field overall. And then third, we're considering this as a flexible platform that can be effectively applied for various neurological applications. So depression treatment, epilepsy, Parkinson, tremor, so many interesting.
Yeah, that sounds really groundbreaking. Thank you for sharing this with us. So,
Sure.
just to make sure that we're on the same page, to me, this is a non-invasive BCI approach. This is a skin patch
Mhm.
that could improve our REM sleep quality.
Yeah,
Okay.
yeah, that's true.
Why, why REM sleep is quite difficult to solve?
Yeah, that's interesting question, but maybe one of the reasons that's kind of less studied sleep phase, and like less studied mechanistic approach, like mechanism overall, what's like what's going on actually during this phase. Because like for instance, like as you probably know, like why we had to use EMG and EOG because they're like some crazy muscle contractions and ice movements during this phase of sleep and so on and so on. So it's really kind of unusual phase of the sleep overall, but it is yet essential. So yeah, I think there are several reasons because it's less studied, and so it's was quite complicated to approach from drug perspective, like drug efficacy, also with various side effects as well, which is not desirable either. But then also neuromodulation, so current like non-invasive neuromodulation, it's also not appropriate, not enough to improve it.
I see. Got you. And as far as I know, the current non-invasive BCI equipments like EEG headsets, I won't say they are a bit bulky, but are definitely not really convenient
Mhm.
to wear and to carry on. But
Sure.
right now, a skin patch sounds much more user-friendly. So what is the technology behind that could make this possible?
Yeah, so this is a definitely a combination of several technologies. So skin patch is definitely interesting solution and what we proposed and what we built, but still it can be not ideal for at home application. And so for now, so we are not like denying this form factor. We still like keeping it in mind, and we'll be like thinking how apply it best for like various application scenarios and so on. But still, we definitely also working on prototyping various headsets and headbands formats. And so, like, if we're talking specifically for sleep, in my perspective, and like a couple of guys from our team, is that something like headband or more like head, which is soft, which is easy to wear, which is not sticky, right? And so various things. And all, like most importantly, it's actually should be convenient for person to sleep, right? So our sleep patch was also fine, but again, it also was just one night of stimulation, so one night sleep, right? And we need to think in perspective like weeks and months or maybe even years of application, right? But going back to our technology, most important innovations definitely two innovations. Like first, focus ultra wearable miniaturized focused ultrasound transducer. There are also various designs how we can build this. So our current design that we use is multi-ring transducer called Kruta, concentric ring ultrasound transducer. So effectively like a spiral, like increasing size of rings, right? And the idea is that the larger the transducer, the deeper we can reach, right? But so our transducer size like about this size for now, right? And also it is, which is cool, it is important, it does have already adjustable focus, like it has steering capabilities. And so what steering means that we could, without rebuilding the device, we could adjust the focus ultrasound focal point between targets, right? And what we're also working on now, we are developing like various designs of such transducers with capability basically to move in any lane, in any plane of the brain to reach effectively like any deep brain region, which also gives us kind of flexibility between persons, between various patients, and then between also various conditions. So this like first big innovation. Second big innovation, what I mentioned before, is our novel hydrogel electrodes. So as you perfectly know, most known electrodes like used by most of clinicians and researchers are either gel electrodes or dry electrodes, and both of them have limitations. So gel electrodes were high quality but very short duration, and dry and quite fast. Dry electrodes super long duration but low signal quality usually, and also not applicable for application like during movement, right? And because signal quality dropping sharp. So we basically build something like in the middle and like that has like benefits of both of them, right? So hydrogel based electrodes, again, like we have already like 3 or 4 generations of those. So we demonstrated in various publications that they were suitable for like long-term application, wearable BCI, and so on.
Got you. We understand how innovative it is right now. Kevin?
Regarding the steering, um, how would that be orchestrated? Would it be orchestrated by the person who is wearing the patch, or orchestrated from like a computer signal or something like that?
No, yeah, very good question. So definitely it should be automated. So it should be automatic steering. And so algorithmic part is very important part of our device for sure. And so for now, in order to target specific deep brain region, we need to do MRI, right? And so so during this study that we completed with NewSleep, we did both structural MRI, basically to find structure in each of specific person, because we realized that there is also some variability between persons regarding anatomy, brain size, target size, and so on. And then also, secondly, we did functional MRI, which is basically to validate that there is blood flow signal change as a result of our stimulation. So basically, which is demonstrates that we effectively stimulate specific deep brain region. And so both of these were relevant to steering and targeting that you asked. And so the idea is that we also collaborate with various research groups on further developing and integrating of some advanced EEG-based algorithms, something like source imaging, EEG source imaging. And so basically the idea is that we plan to leverage our electrodes to record cortical signal from associated deep brain cortical projections, like thalamocortical projections, right? And so the idea that using these advanced algorithms, including AI ML certainly, we'll be able to see changes in specific projections. So for instance, if we wanted to modulate thalamus, we would try to measure and control changes in thalamocortical projections through cortical EEG recording, right? And so basically this would be essentially a closed loop system, and our ultrasound producer will do test stimulation. So let's say like if we don't see effect, it can also change stimulation parameter, do couple of shots, couple of tries. If we still don't see the desirable effect, it will start finding the correct place where to stimulate, right? So this is something like we plan to approach in coming years, and basically to achieve imaging-free, like MRI-free targeting and application.
Got you. I like the way how it works as a closed loop system. And on top of your BCI research background, I also know that you founded a few startups in EU and you currently work as a medical director in a Y Combinator company. So I guess with your startup background, what are the key differences between BCI startup environment in the EU and BCI startup environment in the US?
Sure. So first of all, yeah, there are some specifics because so my previous experience mostly related to Moscow, specifically to Russia, which would be similar in many ways, but still different as well from like Europe in general, like regarding regulation and so on. And also, I cannot compare much regarding BCI specifically, because during that time I was working in other fields. It was all
Okay.
related to health technologies and devices, but not for BCI neurotech much, what I was doing before. But in general, yeah, I would say that regulatory are definitely quite different and like tougher, like more challenging in Europe than in US. So in US, it's quite hard, like for like FDA regulation, right? But in Europe, how it tend to be before, at least it was definitely harder. And also depends on the countries, for sure on specific countries within Europe, but more conservative regarding specific innovation. So definitely like the American like regulation and like clinics and so on. So certainly US still number one, like regarding speed of development and implementation applications of various innovations. But still, there are definitely some leading countries in Europe as well that are trying to keep the same intensity, like speed of like innovation and integration as well. So yeah, I would say access to capital definitely different and could be harder as well. Regarding grants, I think it's quite good in general. So whereas like grants opportunities for research groups, so maybe on similar level to states. And regarding regulation, yeah, maybe I think it's still a bit harder than here. But yeah, otherwise, yeah, I think it's quite close already.
Okay. Got you. When you said that a lot of countries tend to speed up BCI development in research and entrepreneurship. So let's
Mhm.
say when you are about to speak to a bunch of early stage BCI founders, what suggestions do you have for them?
Early stage BCI founders, yeah, I mean, definitely start from basics. So either start from startup basics, like entrepreneurship basics in general, or go to proceed to specifically medtech, biotech, startup, like basic recommendations and something like Stanford Biodesign methodology and book. And I think they did podcast as well. So Stanford Biodesign is one of the best, I think, methodologies for biotech, medtech innovations. And it is basically, it is very aligned to startup in general methodology, startup building as well. All the things like go out of the building, right, and understand your client or your customer and understand their need, their pains, basically focusing on customer development rather than product development. So definitely most of researchers, innovators, especially in more hard tech and deep tech fields, they tend to start from product development. And they really love and very passionate about their product, which is great. But unfortunately, it often leads to early mistakes regarding what they actually need to build. So they could spend a lot of money and years basically to build something that is not actually needed on the market, right? Or for the patients.
Yeah.
So you need to be integrated into real world, into industry and into clinics and into patient needs as soon as possible. Most ideal would be as early as possible to start collaborating with various clinicians who kind of passionate or interested in innovations. And there are quite a lot of clinicians, luckily, who want to participate in something like this, who may be tired of like clinic routine and so on, and who basically wanted to also work on some cool innovations, right? And so basically try to find them and start to work together, consider various ideas, go to their clinics, schedule what they're doing, try to talk to patients, to their families, understand like what actually is the problem, the need, right? So if you develop something like for home application, like home-based device, medical device, BCI, then try to go at least to understand how they like what is their like home routine of these patients, right?
Mm-hmm.
And I ideally go to their homes and see how they actually live, what they currently use for like assistance, and then you would have much better and clear ideas how actually build your innovations and technology that is it's perfectly fit their current environment. So I think this is the kind of the one of the main challenge and problem for many of founders. So I highly recommend to look into this.
Okay, this is a really great suggestion. So technical advancement is important, but marketing validation matters too. And to validate this idea, they have to literally talk to customers. It would be ideal if they can walk into the patient's home and understand their day-to-day routine. That sounds great. I'll end this podcast by one last question. With your strong research and entrepreneurship background behind, what predictions do you have about BCI industry in the, let's say, next 3 to 5 decades?
Oh wow, 3 to 5 decades. I think we'll see definitely a lot of changes and innovations like during next 5-10 years. It's harder for me to imagine like long term where it will move. Yeah, definitely short term is always easier, but yeah, I mean, look at the leaders in the field. Look at like Neuralink doing and like plan to do, and like not on their like current applications, like for paraplegics and so on, but for actually integrate. So their main goal is to integrate BCI with AI, right? And I think this is like one of the largest like direction we should like keep in mind and realize where the whole like field moving to. So whether like we like it or not, because I personally don't like it much, maybe I think there are like much more risks in these kind of integrations, and especially like if we combine invasive technology implant with this kind of integration. So I think it's kind of
Okay.
this direction moving closer to end of humanity. Unfortunately, could be wrong, for sure. Hopefully, yeah, but this is very risky from my side. But still, again, important to understand where it's moving. Then definitely non-invasive, all non-invasive stuff, wearable non-invasive for sure, and certainly shifting more aggressively towards at home application and integrating of your wearable system into like smart home and like integrating with all devices, well, it's computer and so on, right? And so I definitely like I prefer much more the non-invasive direction.
Mm-hmm.
And first, like you have much more scalability, and maybe Elon would be able like to convince like billions of people to implant system like into their heads. Maybe they're yeah. And so maybe we would see some huge something like Tesla club, so Neuralink club, and yeah, people would be happy to implant whatever
Okay.
like they suggest them. But still, I think we definitely like it's much easier to grow and scale, and basically safer uh, for for patients and for people to use non-invasive stuff. Like
Mhm.
if you don't like it, like you can always take it off and then yeah, forget it, right? You cannot do this with implant. And then so it's potentially it's much cheaper, non-invasive again, much more flexible for various applications as well. And like in our case, for instance, like if we compare like implant, and it can be like really minimalistic, like tiny implant, yeah, but still it's implanted into one specific area, for instance, like for one specific application, right? But like for instance, with focus ultrasound or others, steerable technology with combination with algorithms for closed loop format, you have much more flexibility. And you basically with one device you can control various brain functions, and it can be applied for various scenarios, various diseases, and so on. Yeah, so I think something like this. But I definitely expect that whole BCI area, it's really still early yet for BCI, though
Yeah.
it's been over there developed like for decades for sure.
Mhm.
But now it's definitely the hottest time it's ever been for BCI, and I guess it will be even hotter through coming years.
Yeah, I got you. Thank you so much. You just brought up a really interesting topic, which is the risks for invasive approaches. Do you mind if
Mm,
I ask one last follow-up question?
sure. So, do you mean risk in terms of invasiveness, or do you mean risk in terms of potential integration with AI and AGI and so on? Which kind of risks?
I'm referring to the risk you brought up to the humanity when you mentioned Neurawear.
Yeah, yeah. So this is basically general. It's more AI related risk and like this huge scope of like development of AI. And from my understanding, we actually most of us yet underestimating how fast it's developing, and we see only the I don't know, maybe 10%, so some percentage, some smaller percentage of actual development. And the way it is, the whole AI field developing right now, it is too fast and too risky, and no any yet proper regulations. So if this not changing, it's definitely with. So if the situation doesn't change, we are just giving too much power first to corporations and second to AI, to like HI and so on, whatever you call the smartest AI. And then, so this is already like super risky. And this definitely my opinion as well, but I am listening to much smarter and experiencing people in like AI, and I tend to agree with them. So this already were risky. But then if we also add that kind of risk to integration, integration of that system into our brain, which potentially could have access to our brain function, right, and how we functioning, how we're thinking, and so on. Yeah, I mean, this is feels to me like full control by corporations potentially. They already kind of can control us in many ways uh, uh, through our phone, right, and through all the like media and platforms. But then, yeah, essentially, so next step is to integrate all the system into our brains, and yeah, I hope it's clear what I think.
It is super clear. Yeah. All right. Thank you so much, Ilya, for being here with us. Also, thank you guys for watching. I'll see you guys
Thank you so
next
much.
session.
Thank you, guys. Good luck. Stay in touch. Goodbye.